Hi, I'm Dr. Vivek Kumar, Senior Director Neurology, Max Institute of Neurology, Patparganj and Vaishali. And today I'm going to speak on a very important neurological disorder, that is Alzheimer's disease. Alzheimer's disease is the most common cause of dementia, and it is a progressive neurological disorder which causes brain to shrink and brain cells to die. And this leads to progressive decline in thinking, behavioral and social skills, which affect the person's ability to perform independently. The most common being the impairment of memory, that is the recent memory. The person is unable to recall recent events, recent conversation, important dates, and may be unable to recognize familiar faces. There may be word finding difficulty, maybe he may not be able to complete his conversation, there may be problem in reading and writing, there may be confusion with relation to time and place, he may feel lost in his own home, he may not be able to recognize his image in the mirror, isolate himself, he may become socially isolated, he may not interact socially, there may be behavioral problems like anxiety, depression, and agitation, there may be sleep disturbances, he may not be able to complete familiar tasks like reaching familiar places, and he may not be able to organize his work schedule as he used to do earlier. Then there may be problem with judgment and problem solving. So these are the most common symptoms that patients of Alzheimer present with. So basically Alzheimer's results from accumulation of abnormal amyloid beta protein within the cells of the brain. So there is a deposition of amyloid protein outside the cells of the brain and deposition of tau protein in the form of tangles inside the cells. As a result, there is a disruption of communication between the neurons, and that results in global alteration of mental functions. Now, if you see the causes, then there are various risk factors. Some are modifiable, some are non-modifiable. Among the modifiable risk factors, the most important is the age, as the Alzheimer's disease is seen in majority of patients who are 65 or more years old, and the incidence or risk of Alzheimer's increases to 2 times every 5 years beyond 65 years. So age is important. Then it can also happen below 65 years of age, those who have a genetic predisposition. Among the modifiable risk factors which are very important to know, there is a heart and head connection. That is, patients who have a cardiovascular risk factors like hypertension, like diabetes, smoking, obesity, physical inactivity, dyslipidemia, they are at high risk of developing Alzheimer's. Then severe head trauma patients also have a higher risk of developing Alzheimer's. Those have peripheral hearing loss also have a higher risk of developing Alzheimer's. Patients of Down syndrome also have a higher risk of developing Alzheimer's. So Alzheimer's disease is diagnosed by detailed clinical history and evaluation of mental functions. There are structured questionnaires and tests that evaluate for recent memory, judgment, problem solving ability, the attention of the patient, and language functions. There is a structured questionnaire known as dementia battery, which helps in knowing that the patient is